Hello there, I'm Blackbright, broadcasting out of the UK. For those of you who don't know me, I talk about a variety of news items and I just give my opinion on it. And yeah, if I think it might be of interest, and especially if it concerns me, I like to talk about it. So, about 4 days ago, I did a video on blacks and minority ethnics and them dying disproportionately, as we have been told by the media. And I wanted to make it clear that yes, they might be dying disproportionately, but they weren't dying more than white people. White people actually dying more than black people. But because black and minority ethnics are such a low percentage of the population, the number of them dying was out of proportion. And then we had to, in that video, I didn't talk about health workers because that is what's bumping up the figures as well. So if it's the first time you're passing and you like what I talk about, please click the thumbs up, the thumbs down, share, subscribe, and all that kind of stuff. So let's talk about the health workers for a little bit. And we've been hearing that, and before I talk about the health workers, we are hearing a lot about black people, well, not black, but black and minority ethnics, as because they're poor, why they're therefore more times likely to die. They're talking about socioeconomics, they're talking about overcrowding and unable to social distance. I mean, it all depends what sector. Yeah, we know certain sectors of the Asian population that have large families, and even some other minorities could have large families, but that is not the main reason. And you can't make that generalization, because how do we know that those people who died were from large families? Large families are a bit of the past. I mean, yes, like I said, a lot of Asian families, they do tend to be large and they support each other and they get together. And yes, that might be a situation, but it doesn't apply to all minority ethnics in order to justify the figures and why they're dying 4 times more likely than their white counterparts. Now, let's talk about the health sector, because that is a very sensitive subject. And there's a lot of health workers who are working at the hospitals, whether it's in the UK or the USA, and they feel as though they are being pushed to the front line. And given the fact that they are more susceptible, it's not, they feel as though they're being discriminated against, and they feel it's unfair deployment. So what seems to be happening, according to some of the nurses, is that all black and minority ethnics are being deployed to the red ward, which is a high risk ward, and their white counterparts are being deployed to the green ward. And I think what they're saying is that they feel as though, because of their situation and because it's all been blown all over the newspapers, that black people and minority ethnics are more vulnerable than anybody else, they're wondering why they are being placed in the high risk wards. Because wouldn't it make sense that if you have a sector of people that are high risk, you would protect them, wouldn't you? You wouldn't put them on the front line. Now, if you have a race of people like their white counterparts who are more likely to survive the virus and recover from it fully and go about their merry way, then why wouldn't it make sense to put them in the high risk wards and put the black and minority ethnics who are more vulnerable to the virus in the green ward? Now, my thoughts on this is that I think that if you're putting, as it has been the case so far, the majority of black and minority ethnics in high risk wards where it's highly contagious, they're more likely to catch it, they're more likely to die, especially if they have underlying symptoms. Now, if they hadn't been placed in those high risk wards, then they wouldn't have been vulnerable to infection, and you wouldn't have such high figures. I think it's more to do with the fact that they are in close proximity to people who are infected, and then because of their their compromised immune system, they are more likely to catch it, as opposed to it being solely because they are more likely to catch the virus. I have a funny feeling that if they weren't on the front line, they wouldn't be dying at such high numbers. But it would be interesting to have an experiment where they just switched, where they put their white counterparts in the high risk and put the black and minority ethnics in the green ward, to see if there was a rise in deaths of the whites in the health service. I mean, it's not an experiment I think that they would do, but it would make sense just to see whether or not it's because blacks are more susceptible to the virus, as opposed to whether or not it's because they are in a compromised position, they are in high risk situations. And a lot of the black and minority ethnics, a lot of them are here on a visa. So they're not going to challenge, even though they have facilities and systems to report concerns and to speak up. They have speak up champions and all sorts, so that people can talk. A lot of people are very, very wary about talking about their concerns. Some of them, whether it's justified or not, they're afraid they're going to lose their job. You know, if they're on a visa, they're afraid they won't get their visa renewed. They're not quite sure about, keeping their homes. So they feel quite vulnerable, and they're less likely to challenge any order that they're given. And it's a shame, really, because that is how a lot of them feel. And they have a lot of people that say, oh, black people have got a chip on their shoulder, they're always feeling discriminated against, and they're always crying racism. But can you imagine if you put the shoe on the other foot? Can you imagine if there was a disease out there that killed mostly white people, or killed white people 4 times more than black people, and they put white people in that ward? I'm sure that those white people would feel vulnerable. They would feel discriminated against. And that's all I'm saying. It's a matter of perception. Maybe they're not being discriminated against. Maybe it's because there's more black and minority ethnic staff. Maybe it's because they're more qualified to do the job. We do not know, but the perception from the black and minority ethnics viewpoint, and when somebody feels a certain way, that feeling is valid. So if they feel that they are in a compromising situation because they're being deployed into high risk wards, you can't take that feeling away from them, because that feeling to them is real. So we have a situation where we have some members of staff who are feeling extremely vulnerable. They're feeling extremely pressured. They can't just walk out of their job because they need to pay their rent and all sorts. And, I know some of them are saying the PPE equipment isn't adequate. Apparently, the goggles were recalled. They have masks that they say you can get through the side. Droplets can get through the side because they don't fall flat on their faces. They're saying the aprons are too thin. And so they have quite a few concerns that, on top of feeling vulnerable because of their ethnicity, they don't feel protected in terms of their PPE equipment. And maybe this is under investigation, so it is being looked into as to the disparity. So we can only hope that they start deploying fairly, or more fairly, because sometimes it is about the visual, sometimes it is about perception, sometimes it is just about balancing and putting an equal, or maybe not so equal, but at least a realistic balance of health workers of different ethnicities to work in the high risk, and the same ethnicities to work in the low risk. so that people do not feel as though, why are they putting us in the high risk? Is our lives not valued? And that's what happens, you see. People start feeling as though they're not valued. And you can imagine why they would feel that way. So while on the one hand, the health service will probably saying, okay, yes, we're going to put that person there because she's so good at this and she's so good at that. That individual, depending on her experiences, is going to think, oh, they're putting me in here because I'm black or because I'm an ethnic minority. And, it's because, they don't want to catch it. They want me to catch it. And then it starts becoming personal when it needn't be personal. And it feels personal for people who are in that situation. I mean, when you're facing death or the prospect of death, it's very, very scary. And so we all know we have to die. But when you know that you're going into a position deliberately that's putting your life at risk, it must be really difficult. So we have to give props to the health service because they are so courageous. And yes, they trained to look after people, but I'm sure they never thought the day would come when they were putting their lives at risk in order to save someone else's life, which is the situation now. So we do have to give props to the health service, and we have to save our health service and hope that things work out better. Let's hope that they do look at the situation and realise that maybe it isn't just what they think as being poverty and overcrowdedness, because a lot of black and minority ethnics are far from poor. Far from poor. And some of them live in far from overcrowded housing. There might be a lot of people in the house. Sometimes you do get poor people, don't get me wrong. You get poor whites, you get poor blacks, you get poor Asians, you get poor in every sector of the community. But you also get the affluent. So you can't make that generalisation that these blacks and minority ethnics are dying because they're poor and they live in overcrowded conditions. So that's all I'm saying. So it just needs to be looked at in terms of whether or not it is because they have been placed in close proximity to people who are infected, and is that why health workers are dying disproportionately. And also, they were talking about 95% of black and minority ethnic doctors have died. That translates into 11. There was 11 doctors who died. 10 of them were black and minority ethnic, and once again, in close proximity to infected people. So maybe my rationale is oversimplified. Maybe it's much more complex than this. I don't know. I'm just thinking from a layperson's perspective. I'm thinking that, if you put a black group in a highly contagious ward, they're bound to catch the coronavirus and they're bound to die, especially if they have underlying symptoms. And then if you were to switch it, I was wondering whether or not, if you put all white people into that highly contagious ward, would they actually die, or would they get through it and recover from it? Because that would be an interesting experiment, because then you would say, okay, yes, they are dying because of the underlying symptoms that have exacerbated them and made them more vulnerable. And if that is the case, they shouldn't be in the high infectious wards. They should be in the green, low-risk wards. And that's all I'm saying. I hope you found this useful. Your comments, as always, are appreciated. And I think that's all for now. Bye-bye.